Mr. President, the pending business in the United States Senate is to set the stage procedurally so that the Republican majority, 52 to 48, can repeal Obamacare, the Affordable Care Act. That is what we're about. That is the business of the day, of the week, and probably for the week to come. And so we are addressing that issue and others relating to the budget. I'd like to start by sharing a story that was told me by a family that I represent. Richard and Mary Laidman live in Naperville, Illinois. They told me a story, and I'll recount it to you. I quote, "My 13-year-old son, Sam, was diagnosed with leukemia one day after the no pre-existing conditions exclusions for children protection went into effect under the Affordable Care Act. The good news is that the form of leukemia which our son has so far has been effectively controlled by a magic bullet drug. My son is currently a very robust young man and in otherwise good health while the drug keeps him alive. The bad news is the drug, as I understand it, costs Blue Cross Blue Shield about $10,000 a month. Without even going into the issue of big pharma pricing," they wrote, "this means that it would take about $6 million for my son to survive and reach the age of 60. Obviously, we feel dependent on all the clauses of the Affordable Care Act right now. No pre-existing conditions exclusions, no caps on benefits, allowing Sam to stay on our health insurance plan till he reaches the age of 26. Mr. President, the bottom line, according to the Laidman family of Naperville, Illinois, is that the Affordable Care Act is critical to their family's health and financial survival." That's what this debate is about. It's not about talking about promises made in campaigns, slogans one way or the other. It's about families like the Laidman family in Naperville who understand that were it not for the provisions in the Affordable Care Act, their son might not be here today, or they may be penniless. That's what it was like in the old days. If you had a son with leukemia and wanted to buy a family health insurance plan, good luck. If they'd sell it to you, you probably couldn't afford it. And secondly, many policies had limits on how much they would pay. Listen to what she tells us. $10,000 a month just for this drug that keeps her son alive? There were policies that had $100,000 limits on the amount that they'd pay each year. Oh, they were affordable, cheap enough. What would the Laidman family have done if that's all that they had to turn to? Well, sadly, we know that thousands, perhaps millions of families across America face that. That's why the Affordable Care Act made a difference. And that's why it is inconceivable that the Republicans are coming to the floor here saying they want to repeal the Affordable Care Act without any replacement. They've had 6 years to come up with a better idea, 6 years to come up with a list of improvements, and they have failed and failed miserably. Why? Because it's hard. It's difficult. We found that when we wrote this law. Now, let me concede a point to the Republican leader who was on the floor this morning. I'm ready to sit down. I think other Democrats are as well. If you want to change and improve the Affordable Care Act to make sure that American families like the Laidmans of Naperville have a chance for these protections in a better situation, I want to be part of it. And I've wanted to be part of it for 6 years. But the Republican approach has been very simple. All we will propose is repeal. We will not come up with an alternative. It's catching up with them this week in Washington. Have you noticed? Senators on the Republican side of the aisle, even some House Republicans, are saying publicly now, you know, we really ought to have a replacement. It's not fair for us to say to America, we're going to repeal the only protection you have and trust us someday in the future we might come up with a better plan. The atmospherics have changed, and they've even changed with the president-elect. Remember a few weeks ago when he said he thought that provision about pre-existing conditions was a good idea? Well, he's right. And so is the provision to make sure that you don't have limits on your policy, and the provision that allows the Laidmans to keep their son under their family health insurance plan until he reaches the age of 26. Yesterday, Mrs. Kellyanne Conway, as a senior advisor to President-elect Trump, was on a morning show, and she said, quote, "We don't want anyone who currently has insurance to not have insurance." Good statement. Then she went on to say, when she's asked about whether the Republicans should come up with a replacement, she said, quote, "That would be the ideal situation. Let's see what happens practically." Well, I don't know Mrs. Conway, but her observations square with what we feel on this side of the aisle, and more Republicans are starting to say publicly. It is irresponsible for us to repeal the Affordable Care Act without an alternative. It invites chaos. We know what is likely to occur. We know that if there's no replacement that's as good or better, people are going to lose their health insurance. Illinois' uninsured rate has dropped by 49% since the Affordable Care Act was passed. 1 million residents in my state now have health insurance who didn't have it before the Affordable Care Act. Illinois seniors are saving on average $1,000 apiece on their prescription drugs because we closed the donut hole in the Affordable Care Act, which the Republicans now want to repeal. More than 90,000 young people in Illinois have been able to stay on their parents' health plan till age 26 under our current health care system. 4.7 million Illinoisans no longer have annual or lifetime caps on benefits, such as the Laidman family, and that protects them when there's a sick member of their family and they need it the most. And under our current health care system, 5.6 million Illinoisans with pre-existing conditions no longer have to fear denial of coverage or sky-high premiums. I'm going to close with this brief reference. Remember the first thing that President-elect Trump did when he went to visit the state where they were going to keep 800 jobs and not transfer them overseas? He took justifiable pride in the fact that he had jawboned the company into deciding to at least keep some of the jobs here in the United States. 800 jobs. Good. America needs companies to make that decision to keep jobs here. We need all the good-paying jobs we can get, particularly in manufacturing. But do you know what the repeal of the Affordable Care Act means to jobs in Illinois? Well, the Illinois Health and Hospital Care Association knows. They told us that it would have a devastating impact on hospitals in Illinois. That includes many rural, downstate hospitals that are the major employers in their community. And they estimate that we would lose between 84,000 and 95,000 jobs with the repeal of the Affordable Care Act. You can have a press conference for saving 800 jobs at Carrier, but are they going to have a press conference and celebrate when they're killing 84,000 jobs in Illinois with the repeal of the Affordable Care Act? They shouldn't. They should do the responsible thing. Let's work together. Let's make the Affordable Care Act better, more affordable, and we can do it. But the notion of repealing it first and then promising to getting around to a substitute later, that invites chaos. That's going to make America sick again.